In today's video, Liam and I are going to discuss 7 unconventional fixes for knee pain beyond just progressive overload and isometrics.
This stuff is kind of voodoo, but it's important to keep in mind that a big part of rehab is being proactive about getting out of the pain cycle. And pain is very neurological. Specifically, we're talking patellar tendon pain, quad tendon pain, and patellofemoral pain. Okay, Max, tell me your story about knee pad holds.
As my day job, I also work as a swimming teacher beyond strength and conditioning. And the floor of the pool where I work is quite shallow. And when I was instructing one of my swimmers, I accidentally went a bit too far down to the bottom of the pool, and I landed very specifically on the portion of my patellar tendon, like just below my kneecap, where it was really painful. And so that gave me and Liam the idea that if you just desensitize that area to pain in a controlled and microdosed way, in a controlled setting with like a knee pad and just kneeling on your knees in the area that hurts, could that not then address the neurological aspect of the pain by desensitizing you to it?
Yeah, it's pretty low cost, 3 by 30 seconds, kneeling on the portion that hurts. And what you want to do is find where it hurts a little bit. If you have maybe like a pillow under your knees, and then just add another pillow. So find where 1 out of 10 pain is, and then go to 0 out of 10 pain with the padding. Okay, number two is removing pain tracking. So for the first 1 or 2 months, you're going to want to be pain tracking for sure. See how things are being impacted by the variables. But at a certain point, especially when people have been in their head and they're anticipating what's my next pain score going to be, how is this going to respond, just taking out pain tracking for a week and then putting it back in can be pretty darn powerful.
Yeah, absolutely. I had experience with this myself. When you're expecting pain and you've gotten used to neurologically and psychologically a certain level of pain, like first thing when you wake up in the morning, like you're almost expecting your patella to be painful. Maybe you did like a few too many jumps or plyos, or maybe you didn't do enough isometrics. There's also like a placebo effect to it as well. Sometimes just removing the pain tracking score altogether for a short period of time can be very beneficial. You're taking yourself uh, towards a higher level of thinking beyond the problem. It's like taking yourself out of problem thinking and more thinking about solutions, or just not focusing on pain too much.
Yeah.
Um,
Even
yeah,
sometimes
because
when I ask athletes about their knees, instead of saying like, how's the knee pain today? I'll just
mm,
ask how their knee is or how's the knee feeling. I almost
mm.
feel like that like conditions them to give me a less painful response.
So the third unconventional fix is loading the knee with hip extension. If you want to get more tension in the patella tendon, the tendon that runs across the kneecap, then if you train movements that require you to be in hip extension as well as knee flexion, so I'm talking about something like a reverse Nordic, something like a sissy squat where you're really like maximally terminally extending your hip, or a leg extension, maybe where you're leaning all the way back. Something like this, either as like a slow eccentric or an isometric, would I would say be superior for patellar tendon pain and potentially also patellofemoral pain, or improving the stimulus on that tendon because it's in a more stretched state. So you're going to get a better, I don't know if you could say hypertrophy stimulus on a tendon, but you're going to get a better stretch across the tendon.
Yeah, even like fascia wise, just having the length to it. God, that sounded so woo woo, but y'all know what I mean. Come on now.
Functional patterns advocate right here.
Yeah, that's
He
me
mentioned
all
fashion
along,
once.
man. Next up, I want to talk about complete unloads. There's been kind of two pendulum swings here, and I'm going to talk about the third one. So, a lot of doctors and physios back in the day used to say, "Oh, you hurt something, go rest, go ice it, go, don't do anything." And that's very bad. So the pendulum has swung now in the well-educated community to continual loading and movement freedom and all this stuff, which is good. Um, but I do think the complete unload can have utility. And usually when I'm getting someone in, especially if they've been trying to do things already to fix the knee pain, I do like a week or two of complete unload, not even slow squats or isos. Really do nothing, clear the canvas, and then, of course, we'll get to the continual loading and all that stuff.
So the fifth unconventional fix for knee pain is sugar reduction. I'm talking specifically about refined sugar. And this is something I've kind of gone back and forth on recently, but it definitely helped when I was in the throes of like pretty serious, like 5 to 6, maybe even 7 out of 10 knee pain on some days. It's just eliminating or dramatically reducing the amount of refined sugar that you have in your diet. Um, I'll touch on how I've reversed on this recently, but refined sugar, obviously, when you consume it in high quantities and you're not particularly active, if you're having it at a time when you're not active, then it's going to cause a large amount of inflammation. It's going to spike your blood sugar. The blood sugar is not going to have anywhere to go. Like, let's say, for example, your muscle glycogen is fully loaded, your liver is relatively fully loaded, then all of that blood sugar is just going to cause a lot of inflammation around your body. And tendons, obviously, if you have inflamed tendons, then that's going to cause the pain to flare up a lot more than if you had, a blood sugar level that was a bit lower. So this is something I experimented with myself for around about 3 months. I completely eliminated refined sugar from my diet, and it was working absolute wonders for me personally and anecdotally in reducing the amount of pain that I had on a day-to-day level. And the way that I've kind of flipped on this now is that I do allow myself to consume refined sugar. I don't like being overly restricted with food. But when I have refined sugar now, I always make sure that it's at a time when I'm about to be active. So having quick release carbs, refined sugars right before a workout is actually a really good idea because you're about to go and be very metabolically active.
And while we're on the topic of nutrition, one more thing to bring up, calorie surplus while you're trying to heal your body. Probably a good idea. Definitely don't be in a deficit. Maintenance, a lot of people can end up some days in a deficit. I think the protein is pretty big for connective
Mm,
tissue in general. So, if you're in knee pain, and that's the number one thing holding back your athletic progress, I would
mm.
also be in a surplus and eating a lot of protein. Um,
Yeah, just giving your body more fuel to heal with, basically. Definitely don't be in a deficit.
And one of the last points we got here, squatting before jump sessions. I think people are pretty tapped into slow squatting for knee pain now, but I'm talking about directly before your jump session. If you're lucky enough to have access to a squat rack near where you are going to jump, just getting a quad pump can be pretty helpful.
Yeah, or any kind of quadricep dominant exercise. Even just a few sets of like very slow controlled sissy squats before you jump, with support, of course, or maybe even some reverse Nordics, I've found personally to be quite helpful as well, getting a nice pump in my knees. And the last unconventional fix for knee pain is knee sleeves. Wearing knee sleeves. I'm not talking about just when you squat, I'm talking about when you're doing plyometrics as well. There's a few reasons why this could work. One is psychologically or placebo, just knowing that you have something protective over an area of your body that's injured, not permanently, like not forever, but just having this there as a kind of like a psychological band-aid, knowing that it's going to provide you some support, it's going to protect the area to some extent, then that is going to be of some benefit to you when you're training. The second benefit is that it keeps the area warm as well. If you have extra padding around an area of your body, particularly your knee, then that's going to keep it warm even when you're not being active. So in between sets and reps,
Mentally.
this is a bonus tip. Bonus tip.
Bonus tip, yeah. I know, like when I dealt with a string of back tweaks for the last little while. I've been pretty healthy, and one thing that helps, especially when you're in the throes of like back tweak depression from deadlifting, is just visualizing yourself picking up a bar pain free and feeling strong, or like I visualize myself going competing and deadlifting like a lot of weight. Um, Same thing for knee pain, like visualize yourself max jumping. I think that can have a big difference, a big effect.
Yeah, power of the mind. Mind's a very powerful thing.
We'll end it on that, bro. That's good. Okay.